Let's start here of how does the pill prevent pregnancy? It does it in three main ways. The first is for healthy ovulation and for healthy fertility to work the way you want it to. Your brain and ovaries have to be in communication. It operates with something called the HPO axis, which is your hypothalamus, your pituitary gland, and your ovaries. One way that birth control, or we'll just focus on the pill, that prevents pregnancy is it cuts off that line of communication. So there's actually research done that the pill, it can shrink your ovaries. It's kind of like a user.
All right, y'all, let's jump in. I'm here with Haley Smith today, and we're talking all about Fertility Awareness Method. And Haley has so many insightful things to talk about regarding fertility. And really, I was telling her before we hit record that, we've talked a little bit about fertility on the show, but a totally different conversation. And our other conversation was more of kind of an Eastern medicine approach. And Haley's approach is a little bit different. We're talking about preconception health and things about regarding fertility that we just haven't talked about, and the things that really you're not really going to learn from your doctor, right, Haley? So I'm so excited that you're here today. Thanks so much for joining us.
Thanks for having me. It's an honor to be here.
Yes. So if you can just start out just telling a little bit about what you do as a certified fertility awareness practitioner, what that means, and kind of what your goal is with working in this realm.
Yeah, of course. So what led me to FAM, or the Fertility Awareness Method, was my graduate studies in nutrition. I did a 2-year master's degree program out here in Portland, Oregon, where I live. And within that time frame, I took a really specialized approach in women's health. It started really broad, anywhere from menarche to menopause, and then I really kind of shimmied it down into focusing on fertility. And in part of that was because in the second year of my studies in 2017, I quite literally stumbled across the Fertility Awareness Method. It was like a weekend workshop, and at that point, anything women's health, I was all for. So I stumbled into this weekend workshop, had no idea what it was about, but at that point, I was in my late 20s, and it was the first time I was hearing that we can't get pregnant every day of our cycle. There's actually a very short window that you can actually conceive. And there's actually a way that you can avoid pregnancy without synthetic hormones. And again, I'm in my late 20s, my jaw's on the ground. I'm like, why were we never taught this?
Totally.
Like growing up, it's this fear factor of the only way to avoid pregnancy is abstinence. Absolutely. Or go on the pill.
Yep.
And that's a solution for everything. So long story short, at that point, I was hooked. I went on to become a certified fertility awareness practitioner. My teacher is Lisa Hendrickson-Jack. She's the author of The Fifth Vital Sign, which I highly recommend. It's usually a good gateway into this world. And yeah, from there, what I really appreciated about Lisa's approach in my training is, yes, the Fertility Awareness Method is wonderful for understanding when you're fertile versus infertile, but where the camp I really live in is getting to use FAM and what we call your cycle charts as a diagnostic tool. So when we learn how to track your body's fertile signs, which are your basal body temperature, your cervical mucus, and your cervical position, we can understand, yes, when you're fertile and you're infertile, but also where are the gaps? What's not right? What is your body trying to ask for? And where are the best places to dive in to help you reach your goals? So that's what really gets me fired up, and what I see serve a lot of women.
Yeah. No, I love this. And I am totally in the same boat as you. And I think either it was on a podcast episode I did recently, or maybe it was a client I was talking about this exact thing where we weren't taught that there's this window that you can get pregnant. It's like, I don't know why that's even like it. This is something that fires me up. This conversation fires me up because I'm like, why are we never taught this? Like, I don't know. This is such a basic physiological thing in our body that we have, and we were never taught it. It just blows my mind. And so instead we're like, oh, well, got to take birth control because I could get pregnant at any minute. So, got to prevent that,
It's wild. And, we could take it so many different directions of why this is. I think there's big pharma incentive. There's, the lack of trust. And just, we have to acknowledge, what were these doctors actually taught in school?
Right.
There's a lot of good podcasts or resources out there where it's doctors are saying, we weren't taught how the fertility work, or how to cycle tracking work, or how the menstrual cycle works, or how to support things like really heavy periods or period pain. The solution they were taught was to prescribe the pill.
Right.
So it's just, It's so backwards in so many ways.
Yeah, no, it is. It is. And I think that's a great point. And, I say this all the time on my show. This is not to bash doctors, but they really are taught in symptoms and medication and surgeries like that's their training. And so they see a symptom, they prescribe medication. That they're not about like getting to the root cause of the symptoms. That's just not how our Western world trains doctors. And so I think we often miss that, where we're like, oh, well, the doctor is prescribing me or recommending birth control, so I must need it. Right. When that's their answer to the symptoms. It's not an answer to why it's happening in the first place.
Yeah, and I love what you said. It's nothing about bashing doctors. It's just acknowledging the tools that they have in their toolbox.
Right. Exactly.
If the only tool you have is a hammer, then everything's
That's what you're going to use.
Right. Yeah. Exactly. Mm-hmm. And it's just backwards. There's just an unlearning and relearning that has to happen of who are you giving your power away to? Who are you trusting with this information? And what tools do they have in their toolbox?
Right. Totally. So I'd love to talk about kind of on the same topic, things that, because I know you work with a lot of women that you're helping them with things that maybe, things aren't that the lab work isn't going to show, right? There's things that are happening in your body that the lab work isn't going to pick up on. And so, I know in my work as an FDN, same thing, I run certain labs on my clients where it's like, oh, well, the doctor's never picked this up on the labs I do there. So can you speak to that and kind of what the lab work isn't showing that the fertility awareness method can help with?
Yeah, great question. So I think the best way to answer this might be to give an example. So I work with a lot of women who come to me and say, we don't know what's going on. The doctor has thrown around the phrase unexplained infertility. All the lab work is coming back normal. So it's okay, let's back up. Let's start tracking your fertile signs, see what your body's trying to tell us. And unexplained infertility, I think it's a lazy diagnosis. It's just, we haven't found the answer yet. And charting your cycles can help us find that answer. And one way this can show up on someone's chart or menstrual cycle chart is we track your basal body temperature and your cervical mucus. One of the biggest things I see on the charts is something called luteal phase defect, or luteal phases, or otherwise known as post-ovulatory phases that are less than 10 days. What, in my experience and in my teachings, after ovulation, a fertilized egg needs at least 10 to 11 days to implant into the endometrial lining. So what this can look like is if you go to the doctor and yes, you ovulated. Yes, your cycles are in normal parameters because they're more or less 28 days.
Right.
There's nothing showing up. Lab work is normal because you ovulated. So hormones are rising and falling. But what the chart can show us is if you have a luteal phase less than 10 days, that right there is an answer something worth exploring and could be an answer to the unexplained infertility. Because your post-ovulatory phase, you're not even giving the fertilized egg enough time to implant into the endometrial lining. So that's just one example of how FAM and menstrual cycle charting in this way can kind of help find those answers that the lab work and doctors aren't going to explore with you.
That makes total sense. So then I know I've had, I don't work with a lot of infertility in my practice, but I've had, friends and family kind of deal with this. And I know one of the big things that I've had people close to me deal with is it's like they're bleeding every month and they feel like they should be ovulating, but then they find out that they're not. And they're like, well, how do I know? So can you explain that piece of it, how and why that can happen?
Yeah, absolutely. I can explain this kind of from the professional standpoint, but also from a very personal experience of, I think that's really misunderstood is if you are bleeding every month, that does not mean you are ovulating. There are many reasons that we can bleed. And the only way that it's considered a true period is if you ovulated. By definition, a period only comes after ovulation. If you didn't ovulate, then something can still happen called a breakthrough bleed, where your hormones, they build up and your endometrial lining is getting thicker, but it's kind of like a trash bag that eventually just overflows or breaks through the bottom. So we call it a breakthrough bleed, but it's different than a period. So where it can be confusing, right? Because you're like, yeah, I'm bleeding every month. Things are looking normal. But if you didn't ovulate, so we can use FAM and we can use your menstrual cycle fertile parameters to identify ovulation. And that's what I recommend being the first step. I think of all the things we weren't taught about our body growing up, this idea that kind of everything is centered around your period can be really dangerous.
Yep.
Rather, I invite women to think of ovulation as a main event of their cycle, because that can tell us a whole lot. Whenever you ovulate can be really good information. And if you are ovulating, it can be really good information. So once we can identify ovulation, which we can do by tracking your cervical mucus and your basal body temperature, Your cervical mucus is the greatest predictor of when you're going to ovulate, and then your basal body temperature can confirm ovulation.
Mm-hmm.
So once we can identify if and when you are ovulating, then things like the length of your luteal phase can be really good information. Again, is it at least 10 days or is it falling short of that? What symptoms are you experiencing in that time frame? So there can be so much said, but to sum it up, ovulation needs to be thought of as a main event of your cycle, and then we can go from there to see where are the missing pieces.
I like that. I like that a lot. And I feel like, again, to your point earlier, I feel like what you're saying is totally backwards than what we're taught, right? Because I feel like we go to the doctors like, oh, when was your last period? I mean, that's like the first thing they ask you. You go to any doctor, when was your last period? How long did it let? It's like, that's all we talk about, is how long we bled, when we bled,
100%, 100%. And again, it's just, what were they taught? We have to ask that question. Who are you seeking your information from?
Right.
So yeah.
Right.
If you're bleeding every month, but you're not getting pregnant or achieving your goal, shift your focus to identifying ovulation. That would be my biggest tip.
Do you have, just speaking on ovulation, do you have like tips on like healthier ovulation, or how, like, if you're not ovulating, things you can do, whether like, diet tips? We all know stress is a huge factor, so I'm sure you can speak to that too, but are there other things that women can do for healthy ovulation?
Yeah, great question. So I mentioned that I had a personal experience with this. Something that I like to kind of open this conversation with is your body's number one job is to keep you alive. So if there's a threat to your body, if there's a perceived form of stress, your body's going to put something on the back burner, and it's going to be your fertility, because its number one job is to keep you alive. So if you're under some sort of threat, and so there's no way your body's gonna be like, oh yeah, let's grow another life. Let's bring someone else into this picture. So fertility is going to go on the back burner. And what that can look like is shutting down ovulation. And a lot of ways I see this play out are things like under eating and over exercising. And this is where my personal experience comes into play. About a year ago at this point, I was going through a really stressful breakup. I started training for a half marathon at the same time. All that kind of led to not eating as much as I should have. So what I think of as the foundation of our fertility, which is healthy eating, healthy sleep, healthy movement, and stress management, all of those pillars of my fertility foundation kind of went out the window.
Right.
And that resulted in me not ovulating for about 9 months in 2022.
Oh, wow.
So I see this play out in various ways. So if someone is not ovulating, if you identify that you're not ovulating, which again, we can really use your basal body temperature to identify that. That's where I start. Like, okay, how are your stress levels? How are you managing stress? Because the goal, is never to eliminate stress, because that's not realistic, but how well are you managing it? Are you eating enough to support your body? Are you moving in a way that's supportive for your fertility? And how's your sleep? Those 4 things have to be in check. And that's where we have to start to look at your ovulation health. And I think some other signs that ovulation needs some support that's where we can use your cervical mucus. Is your follicles producing good cervical mucus? That's a sign that estrogen is rising. That will communicate to your brain that you have a developed egg ready to go, ready to ovulate. So again, and using a formal method like the Fertility Awareness Method can kind of help you do this all in a systemized way.
Yeah. Do you recommend, there's so many apps and all those things out there. Do you have any that you personally recommend for women to help track their cycles and stuff? Do you have any, or is it, how do you recommend tracking that? Is it an app? Is it like a software? Like, what do you recommend?
Yeah, there's so many things out there these days, right? Apps are wonderful. They're a great tool, but the biggest disclaimer I give and biggest warning is you want to make sure you're using one that's not using the algorithm. Algorithms and doctors, for that matter, they always work off of this textbook 28-day cycle. So what a lot of apps are doing, if you don't turn off the predictor setting, you're going to put when you started your period, and then it's going to predict that 14 days later you're going to ovulate, because that follows a textbook cycle.
Right.
So few women actually ovulate on day 14.
Yeah.
So what I encourage you to do is you can turn off the predictor setting, or there's apps out there that just don't use it at all. The app that is most in line with my approach is one called Read Your Body.
Okay.
It's a wonderful app. A lot of people also like one called Kindara.
Okay.
Those would be my top 2 recommendations.
Okay.
But again, just always make sure it's not predicting, because that can just leave you spinning in circles. One, if
Yeah.
you're trying to avoid pregnancy,
I was just about to say, it's
that
going to
can
be
be
a
a
win
big
awakening.
danger. Yeah, like, okay, great, I'm away from day 14. Or if you are trying to conceive and you're having sex around that day 14 marker, but it's not happening, that can be crazy making. But you could be ovulating on day 20 or day 21. And again, not only is that going to help you conceive or avoid pregnancy, but it's also going to give you a lot of really good information as to where your imbalances might be.
Right.
So yes, Read Your Body, Kandara are 2 good options that I don't think use a predictor setting.
Yeah, perfect. And that's such a good tip. And that's so good to know that, because I mean, yeah, that would be really devastating if someone is avoiding it. Then those are great tips. I
Totally.
love that. Yeah, yeah. Okay, so when going back to the birth control conversation, because I want to talk about this, and I have posted this, I have talked about this so many times about, me and you are around the same age, right? We grew up in this generation where birth control was literally like, you have a pulse and you have a vagina, we're going to give you birth control. Like, we're going to tell you to take birth control. And I was there, took it for years. And now we're in this generation of women where the levels of depression and anxiety and infertility and PCOS and all these things are just astronomical. Autoimmune disease, right? So I would love to hear your take on how exactly birth control affects fertility, because regardless of if they're ever going to do like legitimate studies on this, because as you mentioned before, I mean, big pharma holds a big hand on birth control. So who knows if we'll ever have legit data on this, but I just know from experience and witnessing the world from where I live, this is a thing. So I'd love to hear your take on how birth control affects fertility.
Oh my goodness, we could spend 2 hours on this.
Totally.
Yes. So I talk to women every single day that maybe have just even come from the doctor's office, and the doctors are saying, you can stay on the pill until you want to get pregnant and then just come off and you'll
just
conceive.
Magically happens. Yeah.
Right. And then, they'll even say, yeah, and then once you have the baby, just get back on it. And there's so much wrong with this. So let's start here of how does the pill prevent pregnancy? It does it in 3 main ways. The first is for healthy ovulation and for healthy fertility to work the way you want it to. Your brain and ovaries have to be in communication. It operates with something called the HPO axis, which is your hypothalamus, your pituitary gland, and your ovaries. One way that birth control, or we'll just focus on the pill, that prevents pregnancy is it cuts off that line of communication. So there's actually research done that the pill, it can shrink your ovaries. It's kind of like a use it or lose it situation. If you're on the pill for long enough, your ovaries will actually get smaller. And a lot of that is because that communication is interrupted.
Fascinating.
The second way that it prevents pregnancy is it disrupts your cervical mucus. So cervical mucus is one of your fertile parameters. Upon approaching ovulation, you're going to produce something called estrogenic cervical mucus driven by estrogen. And then after ovulation, it becomes gestogenic cervical mucus driven by progesterone. What the pill does is it makes it permanently gestogenic cervical mucus. So it's like this really thick glob. I've heard some people say the pill will either make it really thick, so like sperm can't pass through, or it will just deplete it and thin it out and just make you deficient in it.
Right.
The third way is it thins out your endometrial lining. So your endometrial lining lines your uterus, and it has to, for a healthy, viable pregnancy, we want it like really thick and juicy so that fertilized egg can implant inside of it.
Right.
What the pill does will really, really thin that out. So if we know that the pill is doing that to prevent pregnancy, whenever you come off the pill and want to prepare your body for pregnancy, we have to restore all of that. So that's the job you're up against. Not to mention, to your point, we have all these gut issues. We have these mood dysregulations. There's really good research that the pill is at fault or plays a part in that.
Right.
We know it disrupts your gut microbiome.
Yep.
It's depleting you of so many key nutrients. B vitamins being a huge one, so many minerals. We know that B vitamins play a huge role in your mood regulation. So yeah, it's not surprising that what we're up against of anxiety, depression, gut dysbiosis. So many things.
The list goes on. Well, and it's crazy to me because if you think like all the 3 things, the 3 ways you just listed out, like and I don't know how
Mhm.
a logical brain of, just using doctors as examples, because they're the ones, like you said, like, oh, just go to birth control and you're ready. And for some people it happens, for a lot of people it doesn't. But like thinking of all those ways that it's preventing pregnancy, like why would a logical mind be like, oh yeah, like all these things have happened to your body because you've been on the pill for the past decade, but it'll be fine. Like you're ready to have a
Right.
baby once you get like that's it's mind boggling to me.
Well, that's where so much of the problem is that's not being disclosed.
Right.
Like,
Right.
and that's, part of my argument here is if the pill is the best option for you right now, great. But what I have a problem with is that all those side effects not being disclosed whenever doctors are
Mm-hmm.
handing it out.
Mm-hmm.
We're not being given a chance to make informed decisions.
Exactly.
If you hear those side effects, if you understand what it's going to do to your body and you still decide it's best for
Yeah.
you, great.
Yeah.
And that also gives you the opportunity to offset some of the side effects. Let's get
Right.
you on some really good supplements that will
Right.
lessen the blow.
Mm-hmm.
And you can prepare better for when you do want to come off and conceive.
Right.
So that's where I have the issue. I have,
Right.
if you decide the pill is best for you, I'm supporting you 100%. But what I have a problem with is you not understanding what it's going to do to your body and
Exactly.
not being given that informed consent.
Exactly. Exactly. And I'm with you on that, which I mean, I feel like this is another. I was just messaging a friend earlier. She was asking some stuff about fertility and stuff, and her and her partner are trying to get pregnant anyway. And I was like, I have all these soapbox on it. She's like, I can't find a doctor who they just want to give me this and that, but I just want to do it naturally. But it's like the same thing where it's like multiple medications. This applies to like pretty much every medication for the most part. There are some doctors who will inform their patients, but so often I feel like we're just writing scripts and nobody has a freaking clue what they're putting in their body. It's like, oh yeah, this helps me with the thyroid. Period. The end. They don't talk about the side effects of the thyroid medication. Oh yeah, I'll just get on birth control because it'll make me not get pregnant. Like they don't talk. So I am with you on that. I could talk about this all day. That part really irks me that, like you're saying, like women are so uninformed about how their body's working, period. And then uninformed about all these different things. And like doctors who are prescribing birth control for PCOS and endometriosis, like that doesn't fix any of those, by the way.
No, it's kind of going to make it worse because
Yes.
like if you're pressing all of these, it's like this fire breathing dragon that once you take the pill away, it's going to come back with more force.
Right.
And, to your point, yes, it's like even some of these fertility drugs that are being prescribed by doctors, you come off the pill, you can't conceive. It's like, okay, great. Let's try Clomid. Let's try letrozole to supercharge ovulation.
Right.
Those drugs were discovered by mistake. And what we now know is that Clomid specifically, it can also thin out your endometrial lining. It can also mess with your cervical mucus. And nobody talks about the success rates of depending on what age you are trying these at. So it's like you try these fertility drugs and you're left worse off if they don't work.
Right.
You need to build up your endometrial lining. You need to support your cervical mucus. And that's also an area where informed consent is not being given.
Right.
So it starts from such a young age. And then, it's just, you add up how much money you're spending on this, because then the goal is like, all right, let's get you to IVF. So let's just do IVF. And then you start this whole other round of drugs and pharmaceuticals. And it's just, it's such a sad and backward cycle that drives me crazy.
Yeah, no, I feel you. I agree. Well, and that's such a good point about the fertility drugs, because I've had clients, well, like I mentioned, I don't work that much with fertility, but I have worked with clients after their fertility journey, and their body is a wreck from all of the fertility drugs and all these things that they've been taking. Like it's just a wreck. So, I mean, you don't think about that too, that I mean, yeah, it kind of gets you to the end goal of getting pregnant, but all these things that are happening in the process from all the things that it's crazy.
I'm so glad you said that. Yes, it might get you to the end goal of that positive pregnancy test, but there's a big difference between racing to the scene finish line of getting that positive pregnancy test and preparing for a healthy pregnancy. If we can take a step back, listen to what your body's trying to tell you, get to the root cause of what is preventing you from conceiving, you are going to be so much better off in your pregnancy. You reduce your risk of miscarriage. And something that I don't see a lot of people talking about is your preconception health. It is the best way to set you and your baby up for long-term health. Your baby's foundation of health starts in the womb, starts in this preconception season. So, and I think another part of this is from such a young age, we're given this timeline of, oh, if you get in your mid 30s, then you're egg quality goes down.
You're geriatric.
Exactly. Seriously. Yeah. You become at risk for geriatric pregnancy.
Yes.
It's crazy making. But I've worked with so many clients who come to me in their mid-30s. We take a year to prepare their body, and then they're better off than when they were a year younger.
Yep.
But I think, again, it's just like so many women, and like I understand it, they want to raise just to manipulate their body to get that positive pregnancy test. But if we can be brave, if we can be patient, take a step back, listen to what your body's telling you, work on building this fertility foundation, you are going to be so much better off. And what we're talking about is, creating healthier generations.
Right.
This is where it starts in this preconception season.
Yeah. And I love that. That's actually where I was going to ask you next, and you went right into it, because I love that term. You talk about preconception health and how that leads to healthier generations. And I think so often, again, I think this is just the Western model, because I think in, Eastern cultures, they have a different view of this. I think they do. They have a different view of a lot of things. But I think in our Western view, I think we don't, many of it, some people do, but I think so often this is a missed, like, I don't know if season is the right word, right? But it's this preconception. Like, we think about all the things once we are pregnant, all the supplements and this, we have to take, prenatals and this and that, but we're not thinking about that preconception health. Like, a lot of times we're not thinking about the state of our bodies to get to that point.
It's a missed opportunity. It's a missed opportunity.
Totally.
And I think just to get really tangible about this, like one thing I think about a lot is PCOS. PCOS is the most relevant reproductive disorder that we're seeing these days. And it can play out in so many different ways. But there's really good research that is starting in the womb, depending on how your mom was eating, what toxic exposures that she was exposed to. That's huge.
Right.
Like, there's a lot of endocrine disruptors out there. So what she was taking in, PCOS, it starts with your genetic makeup, which started when you were in your mom's womb.
Right.
And we can get really crazy, talk about your grandmother's health. I'm not sure if you've seen that beautiful image where it's like you were actually inside your grandma, because you were an egg when your mom was inside of her.
Yes.
It goes really deep. And while it can be scary and overwhelming, what I like to empower women is, like, you have the opportunity to break this chain. You can shift your baby's genetic makeup. You can stop this chain of PCOS and set your baby up for a better foundation of health. Or not just PCOS, but we're talking about thyroid. We see that a ton these days.
Yep.
Gut microbiome, that's starting from when you were in the womb too. So it's a really, really special and beautiful opportunity if we can just take a step back and take a breath and reassess.
Yeah. I love this. I love this conversation so much. As we are wrapping up, I have one more question that I want to ask you. But before I ask you that question, can you let everyone know where they can find out more about you and what you're doing with the Fertility Awareness Method and helping women with their fertility?
Yeah, of course. So a good place to start would be Instagram. That's where I'm most active. My handle is haleysmith.fa for fertility awareness. My practice is called Innate Rhythm. So my website is just innaterhythm.com. And what I offer is a 6-month functional care program that starts from the ground up of teaching women what they were never taught about their body, healing their relationship with their fertility, getting really grounded in what is your starting point. Let's build your baseline chart, see what your body is telling us. And then the meat of the program is building your new fertility foundation. We look at sleep, we look at nutrition, we look at movement, and we look at nervous system regulation. And then the final step is calling in your baby, creating space in your life, creating space in your schedule to call in the baby that you were meant to have. So I do that within a 6-month framework. And, what I guarantee is if your fertile parameters are not ready for pregnancy, not where we want to see them, then I will continue working with you for free until they are. So that program is called Fertility Freedom. I am accepting new clients for that. And a good place to start would just be my website and filling out an application so I can make sure that I feel like I can help you move forward and conceive faster.
That's perfect. What a great program. Thanks so much for sharing that. And I will put links to all that in the show notes, everybody. That's amazing. What a great program. Okay. The last question I want to ask you that I like to ask everyone as we wrap up. What do you think is the most important thing you can do to live with purpose?
I love this question. What I will say, speaking to women directly in this question, is develop body literacy. The more we can understand ourselves, the more we can take back our autonomy and feel at home in your body, it will have this ripple effect out into the world and help you live out your purpose and help other people live out theirs.
I love that. That is such a good answer. And, I love that question because everybody has a different answer, but that is one that's not even like nobody's even had. I love
Really?
that answer. Yeah, I love that answer. It's so good. It's so good.
Oh,
Thank you so much, Haley. This was
thank you,
so
Hope.
informative and educational and enlightening. This was such a good conversation. So, y'all go check out Haley's Instagram page, check out her website, sign up for a consult. And thank you so much, Haley, for what you're doing and helping
Thank
women
you.
and really empowering them to feel at home in their body.
Thank you. It was wonderful to be here. I love this conversation.